the second option in any of those, then you are already on the right track. You don't need to become a genius programmer to join a healthcare AI. And that is the biggest, one of the biggest lies that is stopping people in the healthcare field. Many people believe you must be great at math to work in AI, but honestly, or in reality, many healthcare AI roles are more about judgment than calculus. Many people believe you must code all day to work in AI, but there are several roles, or several of these roles in AI require communication, safety thinking, and then workflow design. Many people believe AI will replace clinicians, but mostly AI would replace repeatable tasks and it will accelerate decisions that are made in healthcare. Some people also believe that AI is always objective and that it can inherit bias from historical data and amplify unfair outcomes. That is also there, but there's also a career, even in that field, that deals with the biases that can come from using AI in healthcare data. That is AI governance. We'll talk about it later on in the show. Many people also believe that AI is always accurate, but AI can be confident while being wrong. The confidence is not correctness. So that also goes along the biases and how we need governance around AI. So healthcare professionals are literally trained to think about what can go wrong. So this is basically why you belong in this space.
You see, my friends, that is why she said you belong in this space. You see, let's start with the careers that, these are going to be just some of them. There are a lot of careers that when you're in a healthcare, you are a professional of healthcare, you can't get in. I will start with the first one as clinical AI specialist. You see, that's the workflow boss role. You see, a clinical AI specialist helps organization implement AI tools safely in real clinical settings, you know, which is something most professionals, healthcare professionals are doing. Now it's turning into AI form. So if you don't know AI, how can you be part of it? That means you'll be losing your job quickly. See, this person asks where the AI fits into, you know, workflow. Who uses it? When they use it, and what happens if it fails. This person reviews whether a tool will increase workload by creating extra clicks and extra alerts. Uh, you see, this person tests whether AI recommendation makes sense for complex patients who do not match textbook examples. So uh, at the same time, this person helps design policies for human reviews, escalation, and documentation when AI is used. See, this person helps train clinicians also that the AI becomes helpful assistant rather than confusing intro. You see, so there's a long list that AI specialist assistant are doing for these um, this particular role. So when you look at it, it's already things that most you know AI healthcare professionals are doing it. But now it's gradually changing. This role faced doctors because doctors understands diagnosis risk, clinical reasons, and decision impact. This role faced pharmacists because what? Medication safety is one of the highest value and highest risk areas of AI. At the same time, it's also faced allied healthcare because rehabilitation plans and chronics care flows needs human context and continuity. So, like I said, there are so many things that are going around AI that can help. You see, the controversial truth is that a lot of AI fails because it built like a demo, harming patients and getting paid for it. You know, quick example are sentences that they can uh, use in a camera, right? So images and all those things are part of things that AI is doing. So AI tools flags space, risk, specimen risks, or it triggers 30 false alarms or one of shift. So if you are in this field, these are some of the things you can do. So imagine a clinical AI specialist fix uh, thresholds, retrain staff, improve trust safety. Imagine that that person is just suddenly doing this already and now adding AI. So now your job will be safe if you have AI. I'll turn over to Val to continue with the careers.
So the next career is a healthcare data analyst. This is one of the most promising, is the fastest entry, and there's a big demand for healthcare data analysts. So basically, what they do is that you would turn, or they turn healthcare hospital data into dashboards and insights that leaders actually use. So if you're a healthcare data analyst, what you are doing is that you will be answering questions like, why do wait times spike? Why readmissions increase, and where bottlenecks happen. So basically, you be the one tracking the quality measures and safety metrics and then connecting them to staffing, volume, and then processes, right? So for example, somebody comes to the waiting room and wait time is 30, let me give a 5 hours, and I'll trade yours number 5 hours, right? So with what this person is doing is that you are basically connecting them, right? So you go there, well, you find out that wait time is 5 hours. Why is wait time 5 hours, right? And then you find out that it's because staffing is low on, let's say, on a particular day, right? Staffing is low on weeknights. So what you're doing is that you are tracking the quality measures, and then with this information, it will help leadership or management make well-informed decisions. So this person helps the departments measure outcomes and prove whether interventions really worked. So you basically become a bridge, right? You are the bridge between what is actually happening on the floor, and then helping to bring interventions. So you are the bridge between clinical teams and IT teams, because you are all speaking the same language. Like I said before, this role is the fastest entry point because you can start and then basically grow into that role. It's perfect for people who like Excel, who like solving mysteries, and who hates when decisions are made, lack of a better word, based on vibes, right? This one, you have actual data to support decisions that are being made. So the role is more for people that like charts, right? You can look at a messy chart and then find the story. It's perfect for people that can explain results to busy clinicians in plain language. The controversial truth is that many hospitals collect huge data and then ignore it because nobody knows how to package that data well. So the fun truth is that you can become the person who packages it well, and then you become indispensable. Quick example sentence is that, say you're on camera, right? You can build a dashboard that shows peak emergency congestion hours and correlate it with staffing. You can show which discharge delays create bed shortages, where processes are breaking. You can recommend change, measure results, and prove improvement with numbers, right? You're proving improvement with the numbers. You can do this still while being a clinician, because analysis work scales better than shift work, right? So do you want to be standing on your feet for 12 hours, sometimes 5 days, 7 days a week? Or like we said before, do you want to be the person doing analysis work, more of using, should I say, mental strength instead of physical strength. So basically, that's what the healthcare data analyst does. Especially in our community, there were a lot of people that have real giftings and skills, right? But some people turned, not necessarily is a bad thing, but some people went into nursing because when they came into this country, that's what they were introduced to, right? That's what everybody was doing, so they decided to go into that field as well. But you may be somebody who is good at numbers, right? You may be somebody who is good at making decisions, at statistics, all that. And this is a field where you can also show your additional callings, your additional gifting. So if this is something that speaks to you, this is one area that you might want to look into. So I'll hand over to Patrick to go to the next one.
Sure. The next one is clinical data scientist. You see, talking about data, most hospitals, like I said, it's a factory data now. We have so many data that we don't know what to do with. And when you're a clinical data scientist, You build machines, learning models that predict risks and support decision making. So this is another opportunity for people that are, like what I was saying, so many people get into this field because that was what is then. Everybody was telling them to get in. But if you like numbers, if you can do these things, that can take you to a different level. And if people are making a good money and at the same time to not standing too much on their feet, you see, they spend time surprisingly amount of time defending what labeling means, because speciesist is the whole chart. It's not always like speciesist reality. You know, getting data, turning into a different things that can answer patients or answer can give to doctors, that can help doctors, make decisions. This person must validate performance and ensure model works across population, not just one group. So this person must check biases, because model can be accurate overall while human harming also underserved patients. So this person must communicate. This communication here. So it's something that when you are not just doing the physical thing, and you want the other side, it can also help you. This role does really require a little bit of Python, which is a programming coding, which is not hard at all. But you know it can be learned. It can be learned, and it's not easy learning it. It's not tough learning it. But clinical reasoning is what makes the whole mod safe, because you know something about nursing, you know something about or you're a doctor, you know something about hospital. It makes it easier for you to take that thing. You see, another controversial truth is that many models look great in spreadsheets, and it failed when it comes to workflow. So if you're already in there, it's easy for you to detect those mistakes. That's why it's so nice when you are already in there, so that you can get your AI stuff, and it makes it easy for you. I also turn it back to how to take the next career.
Yeah, so thank you. So the next one I'd like to talk about is medical imaging AI, right? Or medical AI imaging. So anything that has to do with medical imaging, radiology, pathology, and beyond, there's that AI aspects to it. Like Patrick was saying, for the data scientist, you have to learn Python, right? It's easy. My thing is, if you're been able to get in the healthcare field, either as a doctor, either as a pharmacist, as an RN, BSN, whatever, if you have that mental capacity to get that degree, then you should be able to have that mental capacity to learn any computer codes that come with getting into the AI field. So it shouldn't be rocket science, for lack of a better word. So basically, medical AI imaging is using computer vision to detect patterns in images, right? So like AI, X-rays, sorry, CT scans, MRIs, and then pathology slides. So AI can identify subtle patterns quickly, but it can also misread artifacts, unusual anatomy, and then rare conditions. So medical imaging AI needs clinical experts to label the training data, right? So that means the data that we are using to train this AI to come up with these diagnoses, we need people that should be able to train the data, validate results, and then interpret the failure modes. So this field includes roles in data set curation, annotation leadership, clinical validation, and then most importantly, quality monitoring. Radiographers and imaging professionals are valuable here because they understand acquisition quality and real world constraints. So if you are a radiographer or an imaging professional, this is a job that is also of great prospect to you. So the AI will do its job, and then you, as a subject matter expert, will be that human oversight or that additional set of eyes. So clinicians are valuable because they connect the image findings to real clinical decisions and patient outcomes, as I just said. So the truth is that imaging fields feel threatened because AI is touching the heart of the attacks. But the fun truth is that people who can learn and supervise imaging AI become the new leaders of the field, right? AI cannot supervise or manage itself. We need that human factor. That's one thing that if you didn't get anything from this program. That's why I want you to get that AI is not here to replace humans, but rather it's to help you. So instead of you spending your time doing all the imaging and everything, you have the AI, and then your job is now the oversight, right? The supervision side. So quick example sentence. For example, like I'm just giving an example, right? So an AI tool can detect pneumonia, but it may struggle when the image is of low quality, right? As compared to a human being, when they see the image, for example, I'm not a doctor, but you see the scan and you see some black spots on the lungs, you can tell whether it's pneumonia, irrespective of the quality, right? But if the AI tool has been trained on an image that the quality is high, when the image quality becomes low, the AI may not necessarily be able to, give the right prediction. So that's where that human oversight comes in, right? So the radiography experts knows what quality drops and how to fix protocols and then reduce false alarm. So a path tool can highlight a path AI tool can highlight suspicious cells. It can overcall inflammation as cancer, so that the pathology experts catches it and prevents panic and wrong treatment, right? So in case the AI makes a mistake because it was under low quality, that expert will catch it because you are in that supervisory role. You can come, catch it, and then prevent panic and any wrong treatment. Next career.
So the next one is AI product manager. You see, AI product manager decide what problem AI tools should solve in healthcare. No, now you see the AI, the manager is going to see using the AI tool to decide that. So now it's not a big problem anymore. You focus what you're doing, or professional focus on what they are doing. AI is doing that for them. You see, they translate clinical needs into technical requirement for engineering teams. See, this rule focus on communication, prioritization, and safety rather than just programming. Healthcare professionals excel here because they understand that clinical or what clinical actually needs. See, or how clinicians actually needs, and it makes it so easy because you are part of everything that is going on all the time. You see, product manager controls how AI tools are built and used across healthcare systems. So this role is perfect for healthcare professionals who are organized, persuasive, and great at clarify confusion. It's very good for these people. This role is also powerful because it controls what gets built. You see, the good thing is if you are in there, it's so great. You see, the reason why we're trying to let especially these folks, healthcare professionals, be part of it is if you are not part of it, all the tools are going to build without you guys. And guess what happens? The ones building these tools, they are doing it on their own way. So they're coming from engineering side and they're building in a different way that might not help you. So the earlier you guys get in, the better it help building the tools because it's so fresh. Everybody is scrambling. Where do we do? What tools are we do we need? And that's where product managers come in. They help you to do all these things to be able to do that. See, the fun truth is that you can be the person who make tools for these clinics or actually like them. So it's up to you. Are you going to sit for them to make it, or are you going to be part of it so that you make these tools? Next career.
So the next career is one area that we are very passionate about, and that is the AI safety, ethics, and governance. We actually have a class coming on. It's going to be a 2-month class starting March 31st to May 31st. We're going to teach you about AI safety, the ethics, and governance, and also prep you on how you can get your AI governance certification. With this training course, we will teach you the basics of AI and also include the ethics and governance part. The course also comes with resume. We'll review your resume, we will draft your resume, and then we'll also give you interview and then career coaching as well. So back to AI safety, ethics, and governance. That's called, or you could say, the adult supervision role. So AI safety roles exist because Healthcare AI can harm people if deployed irresponsibly, right? So, like the example that I gave, let's say an AI, they are using AI to make determine decisions when it comes to detecting pneumonia, right? I already gave that example. If the AI was trained under high quality and then for some reason the image is under low quality, the AI can falsely misdiagnose somebody, right, of having pneumonia or even cancer. Just imagine the AI comes and says the person has cancer, and then they start giving the person, cancer medication. The side effects and even the lawsuits that can come out of it when it's found that this was an error. So AI safety, ethics, and governance is a very important. I can't stress on it. A very important career path, especially for people in the health field. This work includes fairness testing, privacy reviews, audit trails, and then model monitoring. This work also includes ensuring that clinicians understand the limitations and ensuring patients are protected. AI deals with a lot of data. So, in this role, you want to make sure, or this will make sure that patients are protected. It includes creating rules for when AI can be used and then when humans must override it. Here, humans overriding mean that humans will be the one doing the oversight, humans will be the one giving the final decision. With this role, it includes investigating failures, near misses when AI recommendations may or can cause risk. So it's perfect for professionals who are patient safety minded, right? People who, like, the advocates in you. Sometimes you're a nurse and then you see certain things that is going on in the hospitals, but you don't necessarily have the power to speak up. AI ethics, safety, and governance. If you have an advocate in you, this is an area that you are will be beneficial to explore. It's growing because regulators and health systems are demanding oversight and accountability, right? Because it's a very huge risk area. So they need people that will come in and then oversee or supervise the oversight and accountability aspects of that. So the truth is that a confident AI is scarier than a silent AI, right? Because if it's confident, if it's overly confident, it might be making certain decisions or diagnoses that may not necessarily be accurate. That's why we need that whole human governance. And the fun part is that you get paid to prevent disasters and protect patients at large. Let's go to the next one.
The next one is generative AI. Basically, prompting design. Generative AI will focus on designing a safe workflow for uh, tools like summarization and documentation support. These professionals ensure AI assists uh, clinicians rather than just replacing responsibilities. Like you were saying, all these also come to the safety part. So it's so easy. Prompting is something that is very, very easy. And if part of healthcare and you're doing prompting for healthcare, it becomes very, very easy. Healthcare knowledge is essential when it comes to prompting, especially for hallucination. When you say hallucination, it's about where false information are being plugged in, or when false information are coming out. We know AI is doing it best. We are just in the initial stage. It makes mistakes too, and we need these. And let's say if it's you guys are on health side and there's mistake, you might easily catch them. So this is a bit another field that is also very good, and it's very unsafe for recommendation. AI is treated like let me say a junior intern who this portion is like a junior intern who work must always be reviewed. That's like how AI is. And like you said, it's us human beings, we need people to be able to also check those things. Not that it's AI, so it doesn't need continually. It has to be people, humans checking it. So this rule blends clinical documentation expertise with oversight. So it can't go without humans. We still need them. But if you don't be part of it, gradually you'll be losing your job. See, this person builds workflow for discharge and instructions, patients education, draft, refer letters, and note summarization. This rule is very perfect, like I said, for healthcare professionals who understand documentation quality and clinical communication. Um, Another controversial truth is that Gen AI. can write beautiful uh, nonsense if you do not, supervise it. That's why we always need that people to be able to make sure we have the right information. The funny truth is that supervised generate can reduce burden, especially admin burden, because we know how dramatic when you're trying to correct stuff, and it can easily do that. Next one.
So let's talk about pay and growth, right? The reality of it. So as we are speaking, I'm sure a lot of you have questions, have ideas. Many healthcare professionals move into the AI roles because obviously you want more time, control over time, impact, and then burnouts, right? We are all aware of the burnout in the healthcare field. So there are many hybrid roles that pay well because they will combine your clinical expertise with technical value, right? And then that's work life balance, right? You get time, you get more time to spend with your family. So maybe many people start in analytics, healthcare analytics or informatics, and then gradually evolve into data science products or governance over time. So like I said, don't let the word analytics scare you, data science. If you've been able to get a healthcare degree, you've been smart enough to get a healthcare degree, you should be smart enough to get into AI. Your first goal is not the perfect job, right? So let's say you are first starting, but it shouldn't be the perfect job or the job in this field. It shouldn't be too picky. Okay, you shouldn't have a checklist. Your goal is that you want a role that will put you close to data, any role that will put you to close to data or systems, and then AI projects, right? So that's what you should be looking out for. When you take our training course, we will mentor you and guide you, even when you are looking for a job on Indeed, some of the keywords that you need to put in to bring you closer to these rules. Your second goal is building credibility through projects and outcomes that you can quantify, right? So basically what this is saying is that you should know your stuff, okay? Make sure you get into you get take training classes, so you can have some credibility to your name, for lack of a better word. The truth is that credentials can open doors, but proof of skills keeps you inside, right? So you can have XYZ certificate, you can study in Ghana, would say chew and pour, you pass the test, but you need to prove, right? The proof of your skills. And how you can enhance your skills is the same thing I'm saying: training courses, studying, reading books, practicing. That's how you become um an expert in your field. So the truth is that one strong portfolio project, right, can beat five generic certificates. So just one project that you have done in that specific field, if you're, let's say, somebody's looking at your resume, right? A hiring manager is looking at your resume. Somebody has five healthcare certificates, but you are an expert in AI. If they have to decide who gets the job, obviously it's going to be with that person who has spent time training and developing their skills in the field of AI. So I'll turn over to Patrick for the final reality check, and then we'll have our closing words.
You see, my friends, that's why I was saying the other time, no degree, but when you're expecting something, you can still get something out of it. You see, the final reality check is, I'm going to go there, but see, I'm all about finance and how you can use this to be able to move on and do your finance as well. See, anytime there's a revolution like this, it's a transfer of wealth. If you stay behind, you won't be part of it. The people that will get involved are the ones that are going to get more something out of it. So do not sit like, especially we Africans, we usually, when there's anything, any transition or any revolution, we just be there, wait till some people get in before you. We want you guys to get in quick and get in earlier, so that when there's any transfer, you get your share of it. Not that alone, because we also need ownership. You see, this time is wide open. We can be part of owners in these things, you know, when you know these things, that's when you can create your own stuff. You can create your own agent and sell them. Your own things that can also make you more, because I'm all about working for yourself. So even if you can create something, you can make a lot of money so that you can invest in something. At the same time, too, when it comes to investing, like in the stock market, there are a lot of things that are going on. These AI companies are doing very well. That's where we should focus on. If you know nothing about it, you won't be able to invest in the right things. But when you are in there, that is when you start looking into the AI companies that you can also invest in. So we can get so many out of this just being part of it or getting involved in it. Like I said, I'm all about making sure there's going to be a huge, or it's already going on, huge transfer of wealth going on. And if you sit on the sidelines, you won't get any. So be quick and be part of it. Join the program that we are doing. Uh, and also, it will help you get certification to be able to get a job. So in order to say this, also, if you ignore AI, like I said, you might not lose your job tomorrow, but you might lose leverage gradually. See, it might not happen right now, but gradually. I don't even believe it's gradually. I think it's coming. It's already there. You know, you can see on different side. Maybe it hasn't got to the corridors of the of healthcare professionals, but it's very close because it's already in there. Your hospitals also adapt tools, and you'll be expecting to adapt those tools. What are you going to say if you're not part of those tools or you don't know anything about those tools? See, the best time to learn AI was yesterday. The second best time, literally, is now. So when you see what we have on here, be part of it, register for the class so that when your hospital are bringing it, you're already in it. You know, Clinicians who understand AI will become the decision makers while everyone else becomes the end users. And you don't want to be the end users. You want to be involved. Like I said, this time we are not going to be sitting on the sidelines. We want to be involved. So you do not want to be the person who says, "Oh, they implemented this and nobody, told us how it works." No, you are part of the implementation. That's what we are trying to say. Be part of it. Get involved. You know, you want to be a person who says, "I led this pilot. I was part of this. I monitored this. The outcome, I was part of it, and improve safety." Because we didn't go too much about the safety, the biases and all that. But there are so many things that is going on that, especially Black folks, Africans, we need to be part of this so that we can make sure we are training AI right. I'll turn on to Val to
Yeah, so
close.
my final words, one of my favorite saying is information is key to transformation. So if you already watched this program, then let me tell you, you are one step ahead than most of your colleagues in the medical field when it comes to AI. So once again, thank you for joining. One thing I want you to remember that healthcare burnout, right, is not a personality trait. Sometimes you're so burned out at work, standing on your feet for 12 hours, and when you come back, you're burned out, and gradually it has become part of your life. Today, I want to remind you that it's not normal, it's not a personality trait, and that there are other ways out. And one of the promising ways is what we have presented to you today. So now you have the information, now you have the knowledge. So it's time to get up and then take power into your own hands. Thank you.
Again, like I said, mostly I'm more on the finance side, how this is going to help you so that you can help your family, your community, your country, and the whole world. So get up, be part of the class, register, and we all do it together. Again, make sure you spend wisely, save intentionally, and be generous. See you again, and the class starts on 31st March. So we have ample time to be able to prepare. I put a link in the chat. You can use that link to register for today. Talk to you guys later. See you on the next video. Bye bye.
Bye.